Hear me?
Yeah, we can.
Perfect. Thank you so much, sir, for the introduction. And on this onset, I would like to thank AOS and Zeiss for giving me this opportunity. Today, I'll be talking about EQ markerless workflow. See, all of us keep thriving for efficiency to save time and indirectly save cost too. But what is efficiency? Efficiency is something doing better than what is already being done. So let's look at what is already being done. So there's been a lot of manual markers, and it's really tested time and it's done a pretty good job. But the problems is the errors occur because of no reference point, because of head tilt, cyclotorsion, or sometimes when you excessively wash the cornea, the marks go away. As you all know, every 1 degree of misalignment of the toric lens, we lose about 3 degrees of the corrective effectiveness. Now, when we look at the routine three-step technique of manual marking, first you mark the horizontal meridian at the slit lamp, then intraoperatively you mark the 0-180 and also mark the intended axis where you want to orient your toric lens. Now, when we follow this particular technique, the studies have shown that with the bubble marker, the studies have shown that there's a mean error of axis of 2.48 and total error of toric eye alignment is 4.98. This is where the Callisto comes in. Basically, it is nothing but a markerless intraoperative device, which gives you an overlay with the help of the reference images of the limbal vessels. And this way, it doesn't matter the cyclotorsion, the patient moves, it compensates for it and gives you the perfect access to orient your lens. It's not just used for lenses, but toric lenses, but it can be used for creating your incisions, your LRIs, so that you correct the corneal astigmatism manually, or even to perform the perfect rexus, the perfect round rexus, and also a centered rexus, which is very crucial for these premium IOLs like toric lenses and a multifocal or trifocal lenses. Obviously, it is also a very useful tool to orient your toric lens. All my toric patients, I always implant a CTR. I implant it under irrigation. When I'm implanting the trailing haptic of the CTR, I hold the trailing haptic with the microforceps and place it into the bag. This simple technique, I think no matter what, you'll be rest assured that the trailing haptic won't get into the sulcus. Now, why CTR in all my patients? Now you can see this intraoperative OCT where there's a huge gap between the posterior capsule and the optic. This is one of the reasons why there's a higher risk of rotation during the early postoperative period. But what actually happens when we implant a CTR? When we implant a CTR, it expands the bag, brings the anterior and posterior capsule closer together, and thus increasing the contact between the posterior capsule and the optic, thus preventing or further reducing the chances of it rotating. As you can see, this is a post-implantation of the CTR. There's a beautiful contact between the posterior capsule and the optic. It also has an eye tracking so that if the patient moves, it follows the patient. And this is how the overlay looks. It is so easy to align the toric lens with the help of this overlay. Once you have aligned, you're rest assured you have perfectly aligned your toric lens. Now, what's the difference between a marker and markerless? Actually, in terms of quantity of vision, definitely there's not much of difference. But in quality of vision, there is a significant difference, which is very much more significant or more profound when you're operating a toric, trifocal, or a multifocal lens. And all studies have stated or confirmed the same. Now we have good hands and we have good machines. Is that enough? No. We really need to connect them. And this connection should be actually a seamless one. This is where the Zeiss EQ workplace comes into picture. Basically, what it does is it integrates or brings all the machines in your hospital together into one particular platform. Now, it basically uses a software called, a forum, which, wirelessly transfers all the data. Now, let's look at what actually happens in the OPD or how a workup happens. First, the biometry is done. Now, this data is wirelessly transferred through the forum into the EQ workplace. Now, not just the biometric data. In fact, any other machines you have in the topography or any other machine you have it in your hospital, all the data will get directly wirelessly transferred to your EQ workplace. And this can be accessed from anywhere, be it your office or even at home, or doesn't matter, even in the car. Now, the first thing what you need to do is you need to log in. When you log in, you need to choose or specify what is your default settings. In the sense, some people have a preferred formula, what they normally use, IOL, what they use, sometimes the order quantity, or even the emails they send the order to. So you can just, personalize that first. And once you have done it, you don't have to repeat it. It's just automatic after that. So once you've done that, all the data gets populated automatically, which is very important. This reduces the amount of error. And once you select the lens which you prefer, or what you're planning to implant, you just have to press the button order, and you're done, and you're good to go. Now you can also do your surgical planning. Basically plan where you want to create your main incision, side ports, even the position of the toric lens. And this again wirelessly goes to your OR. You don't need to do anything, but just in case you're very busy, you can't do this at home. I mean, at your workplace, you can even do it on your phone itself. So even if at all you have a long drive from home to work, you can just do all your surgical planning in your phone and just press enter, and that's it. It goes to your OR again. Now, when you're doing your OT, once you have selected the lens box, in fact, you can scan the same box and upload that data into the EQ workplace, so that you actually know what the lens is actually in the patient's eye. Now, one of the key or important feature of this particular EQ workplace is you can really personalize the IOL constant, which is very, very important. And you can personalize it to every surgeon, and also the particular lens which you are planning to implant, because some people don't have one particular lens. They have multiple lenses, 3, 4, 5 lenses. So every lens you can really customize so that your results are very tight. So does all of this actually increase efficiency, or is it just a gimmick? So we did a study where we looked at what is our routine flow, time taken in our flow before we started using EQ Workplace. So this is the range from 8 minutes, 30 seconds to 62 minutes, 30 seconds. And after implementing EQ Workplace, we had a flow of, the time taken is about 55 seconds to 1 minute, 22 seconds. We saved almost about 7 minutes per patient, that is. It's similar picture, even the intraoperative period, where if you look at the EQ markerless workflow, if you use it, we save about almost 7.5 minutes per patient. So now let's calculate, okay, normally in our hospital, we do about 100 and 150, but let's round it to 100. We have about 100 surgeries. That means every patient 700 minutes. That means we are saving about 750 minutes. That is absolutely, very precious time, which is a very significant difference from pre and post. Now let's get into the patient's shoe. Definitely none of us want a long, inefficient patient workflow. We like it nice and sweet. So let's look at the patient flow without the EQ markerless workplace. As you all know, during the surgery, we have to apply local anesthesia for such patients, not just once, actually twice. Once at the slit lamp and once during the intraoperative period. So this is very toxic to the epithelium. As you know, the more number of times you apply the local anesthesia, it damages the epithelium. And finally, you will have a picture like this with the punctate epithelial erosions. And because of this, what happens is that on the day of surgery, patient will have a lot of discomfort, decreased vision, a lot of watering. The experience is not that great. But when we look at the patient workflow with the EQ workplace, the markerless EQ workplace, there is absolutely no added steps. The patient will feel like he's just like any other monofocal patient. He just comes in and goes out, and the vision is recovered much quicker. And also he has so much comfort even from the day of surgery itself. So that's fantastic. So I would like to conclude by saying we need to be efficient, not just at work, even in small things that we do in life, be it like brushing or even wearing your clothes. Keep thinking of the most efficient way you can do it. That way, no matter what you do, you will be efficient at a subconscious level. Thank you for your time.
I think that was a wonderful